We're going to be doing a series, about 10 or 15 series, 10 questions. You can find them in ADAPT NCLEX. This is the first question. Appropriate or not appropriate? What is the problem? A nurse is caring for a client with end-stage brain cancer who is receiving end-of-life care treatment and refusing to eat. Which of the following actions is appropriate? Keywords, refusing to eat. Second keyword, buzzword, this is how you answer question. It's end-of-life care, and he has brain cancer. I've underlined all the buzzwords. What is the concept for end of life? Never force them to eat. Don't do anything that will bother them. It's all comfort. They are in charge. You are not in charge. Therefore, for this question, what do you want to do? Request NG tube feeding. It's not appropriate for this situation. Request G tube test taking strategy. If you're not going to put the NG tube in, you should never put the G tube in. It's not appropriate, right? Document client refusal. Yeah. If he said he doesn't want to eat, don't force them. Provide oral care. Probably there's something in his mouth that is causing the problem. Assess for nausea, right? And engage client in meal planning so they can select whatever you want to eat. And recommend megastro. This is the stimulant so that probably he can eat. Concept-based, fundamental series, right? 10 to 15 series will cover everything about fundamental instead of giving you lectures. But this is the content. And this is caring for a client using crutches after left cast placement. Every time they give you a cast or something like a crutches, pay attention. It's a left, right? Left side. So pay attention that you know that is the left side. So I'm going to underline left. So this is the affected leg. So every question, I have to think about it. Which of the following is concerning? If you're using crutches, which of the following will be concerning to you? You stand in tripod position. Are you worried about it? That is what you're usually supposed to stand when you're on crutches. Crutches and the left leg move together. Crutches and the affected leg move together. It's not concerning to you. Like I said, trying to make you comfortable when you see the NGN questions like that, you don't run away. Clients look down when walking. You're not supposed to look down. You fall. Look forward, right? It's concerning. Neck muscle stiffness. This is suspected because he's looking down. So once in a while, they will get neck stiffness. It's not the priority. Occasional upper arm spasm. When you hold the crutches, your arm going to go into spasm. Not concerning. Numbness and tingliness of the arm, yeah. Improper crouching. Therefore, that's worrisome. If another cast is itching, yeah, I'm not worried about it. So this is, like I said, content straightforward, adapt and clear way. Number 3, do you know Alzheimer's disease? How much Alzheimer's disease do you need? And then this is observing a new graduate assess a client with moderate Alzheimer's disease. Which of the following action need intervention? So which of this you need to intervene? Assessing some patient with the Alzheimer's disease and the new graduate. New graduate ensure quiet environment. Excellent. So that the lady who has cognitive problem can focus, right? So no intervention is required. New graduate uses simple statements. Excellent. No intervention is required. New graduate uses what? Direct question. You see, directly, it's not making it too complicated. Direct question, she can answer yes and no. No intervention. New graduate uses open-ended question. I'm worried. She's confused. She can use open-ended question. You got to make it easy for her, right? New graduate speaks in a normal voice. Yes, don't shout. No intervention is required. New graduate faces the client. No intervention required. New graduate allow ample time for the response. No intervention required. What have I done? I've given you concept of how you should be talking to Alzheimer's disease patient. You know it, but then when they put it in the table, you got to figure out, you think it's a hard question. It's the same select or apply in the different form, in the different shape, in a different strategy. And so that's what I've given you. I've given you ways to talk to Alzheimer's patients, right? So that's that question. Number 4. A nurse is observing a new graduate, assess a client with what? Legal blindness. Now you have somebody who is blind. How do you talk to them? Which of the following action need intervention? We need to intervene if she did something wrong, he or she, right? Patient is blind. It's not like they cannot hear. It's vision problem, right? New graduate orient the client to the surrounding. Excellent. So that it doesn't fall. Hey, this is where your pen is. This is where your watch is. This is where your bag. So no intervention is needed. New graduate announce room entry and exit. When you come in, you tell them, hey, I'm coming, I'm going, so that you know you have left. No intervention. New graduate uses clock face to orient object location. You look at the clock face, said it's on 3 o'clock, 5 o'clock, 6 o'clock. If you give them food, you do the same thing. Your rice is on the right, your spoon is on the 3 o'clock, and your knife is on 8 o'clock. Yeah, there's no need for intervention. New graduate instruct client to use cane with the dominant hand. So they use their dominant hand to use it. Yeah, that's no need intervention. New graduate hold client hand during walking. You can't hold their hand. They're blind. You're supposed to stand in front of them. And therefore, that will be require intervention. You stand in front of them and you give them your elbow. New graduate walk side by side with the client. No, you can't walk side by side in front of them and give them the elbow. This needs intervention. New graduates speak in a loud voice. No, they can hear. They just can't see you. You don't need to do that. Content-based, ADAPT NCLEX, like I said, fundamental series, NGN Gold membership. You should join it. Number 5. A nurse is observing a new graduate, provided teaching a client with the right foot fracture, prescribed what? Crutches, right? Which of the following teaching need intervention by the nurse? Well, the patient has been prescribed what? Crutches. He has right foot fracture. So right foot, and they've been given crutches. Ensure 3 to 4 finger breadth, right? 3 to 4 finger breadth between axilla and then part. Yeah, that's the distance that you need. No intervention is needed. Flex your elbow at 90 degrees. This is wrong. You need like the 20 to 30 degrees. So this need intervention. Move crutches and unaffected leg together. You should not move crutches with unaffected leg. You're going to fall. Your affected leg cannot hold itself. So crutches and the affected leg. Therefore, this needs intervention. Crutches, hip crutches 15 centimeters apart. This is fine. Bear weight. Okay, no, this is fine. So that's not good. Bear weight on the armpit. So this one does not need intervention. Bear weight on the armpit. You should not bear weight on your armpit. You should bear weight on your hands. So this need intervention. 2-point stand for partial weight bearing. Yeah, if you can bear weight and it's partial, you can do 2-point stand. So no intervention needed. And if you are non-weight bearing, 3-point stand, which is the tripod. This is the same thing as the tripod. So this does not require intervention. ADAPT NCLEX way, right? This is what I'm trying to teach you. You see, fundamentals can be made easy. It's content mastering in a simple form. And this is observing a new graduate after teaching on proper use of medical interpreter. Do you know how to use interpreters? Yeah, proper use of medical interpreter. Which of the following action indicate the need for further teaching? So, and this is observing a new graduate after teaching, after being taught on proper use of a medical interpreter. You see, those are the bars where I've received teaching on proper use of medical interpreter. Which of these indicate need for further teaching? So further teaching or no further teaching? New graduate use of client family member. Yeah, further teaching. You can use family member. New graduate faces the interpreter. You should not face the interpreter. You talk to the patient. So further teaching is needed. New graduate does not allow time for interpretation, right? No brainer, right? New graduate asks 2 to 3 questions at a time, one single question at a time. New graduate include medical jargons. You're not supposed to include medical jargons. New graduates speak in a long sentence. No, short sentence. New graduates select client preferred gender. Yeah, you want the male or female? That does not require, no further teaching is required. What have I provided you? I provided you the way to avoid traps. I've given you the negative of what you expect. So test taking strategy, flip them. You know that this is what I'm not supposed to do. So the other way, this is what I'm supposed to do. That is the content mastering fundamental series, NGN Gold. Number 7, right? Like I said, quick question, straight to the point. All you need, and I'm not going to tell you so many bunch of stuff, direct to the point, not to waste any brain cells in your head. And Nance is preparing to admit the client with what? C. diff, right? Buzzword, who has been what? Having profuse diarrhea for 5 days. You have C. diff, you have a lot of diarrhea for 5 days. Exams reveal heart rate of 110. Which of the following the name should expect? Critical thinking. You're having diarrhea 5 days and you tachycardia. What should I expect? This is dehydration. That's the way the board will ask you, dehydration. Increased creatinine, expected. Decreased BUN. If creatinine goes up, BUN has to go up so that we can maintain 20-to-1 ratio. Therefore, this is not expected. Increased hematocrit. Yes, dehydration. Decreased hemoglobin. No, not expected. Elevated blood pressure. No, not expected. Decreased MAP. Yes, your MAP is going to decrease. Elevated urine output. Not expected. Elevated what? Elevated hand veins or engorged hand veins. Your hand veins is going to be flat. It's like elevated central venous pressure, like CVP and hand veins are going to go down, so you don't expect them. This is the way they will ask you about dehydration questions and how to think about it. So I've given you key facts that you're supposed to know for this kind of problem, right? That's dehydration question. And this is what you should expect the board will ask you, trust me. Number 8, and this is caring for a client who is what? Complain of swelling at the IV site. So he has a swelling at the IV site. The nurse suspected infiltration. So the IV is infiltrated. Which of the following the nurse should include in a plan of care? If you're a patient who has IV that is infiltrated, what would you do? Number 1, prevent the edema and other things. So apply cold compression. Excellent, right? Elevate the affected extremities to prevent the edema, right? Discontinue IV infusion. Yes, no brainer, right? New IV line on the contralateral extremities. That means on the opposite side of the leg or extremities. Yeah, not epislateral means the same side. Apply warm compression if vancomycin was infusing. You can ask yourself, why did I put vancomycin there and I put warm compression? This is the way when you take a test, you can see that the board examiner is trying to let you think. Vancomycin is a vesicant, okay? And it can cause necrosis. Something that can cause necrosis and it's a vesicant. You should not put warm because then it can burn the skin, right? Don't include it. Incident report if skin necrosis. Yeah, if the skin die, put incident report. Notify MD if hand weakness. Yeah, if your hand is weak, that means we affect the nerve tissue is dying. That is included. Once again, this is a content mastering in the form of NGN. So I'm giving you things you need to do. When you see it in the test, it's infiltration. This is what you do. Straightforward in the easy way as much as possible. No much comment. Right? Simple. Number 9. Number 9. And then she's caring for a client with what? Now I can hear. Hearing loss. How do you treat a patient who cannot hear? Which of the following require intervention by the charge nurse? Nurse speaks in the loud voice. Well, you're confusing them now. So, needing to intervene. Nurse directly fakes the client when speaking. Excellent. So they can read your lips, right? You can read your lips. Next, turn off the TV when speaking. Right. Excellent. You can get the attention. Next, dim the light when speaking. No, they want to read your lips. So this need intervention. Next, ensure hearing aids are functioning. Yeah, so that if they're wearing hearing aid, they can hear you, so that's no need intervention. Next, uses facial expression and hand gesture as needed. Yeah, you surely, so that you can show them sign language, they can see what is going on. No intervention. Next, first gain client attention. You get their attention so that they're not distracted. They have hearing loss, so that they don't get distracted. So this one, no intervention is required. Right. You get the point now? NGN Gold fundamental, short way to learn your NCLEX, right? And you will not even need a Q bank. And then it's caring for a client who is now post left modified radical mastectomy. So pay attention. Left, and you have mastectomy. Remove all the lymph node. That's modified radical mastectomy. Which of the following is indicated in the plan of care? So indicated. Flexion and bending of the left fingers, right? It's the left hand. So left fingers, this can improve blood flow. It's indicated. Supine, this should say supine, okay? Supine position. Supine position with hand resting on the bed. No, you can lay in the supine position, not indicated. The arm and shoulder exercise day 2. Yeah, this will improve blood flow. You should start exercising. Semi-fowler position with the arm over 2 to 3 pillows here. Raise the arm extremities that is involved in the surgery over a pillow. 2 to 3 pillows is enough to raise it up as much as possible. This is included. Q4 blood pressure cuff on the left arm. No, you should not be checking blood pressure over there. Daily blood draw from the left arm. You should not be drawing blood from there. And incentive spirometer 10 times an hour. Of course, yes, to prevent respiratory problem. This is NGN Gold. Fundamental series, number 1, 10 questions. Expect more like that. Good luck and all the best of luck. Bye.